Imagine a major blood clot suddenly blocking an artery. The clock is ticking, loud. Every single second, vital tissue is at risk. Today we're going to dive into Tenecteplase, a really powerful drug designed to win that race against time. This is the story of the ultimate clot buster.
So here's what we're going to cover. First, we'll set the stage for the emergency, what we're calling the race against the clot. Then we'll meet our hero, Tenecteplase, and break down exactly how it works its magic. We'll also get into who's a good candidate for this drug and, super importantly, the risks and the special care it requires.
All right, let's paint the picture. A major artery, one that feeds the heart, gets blocked by a blood clot. Instantly, you're in a crisis. With every moment that passes, that precious heart muscle is starved of oxygen and starts to die. This isn't just an emergency, it's the definition of one.
And that leads to the big question, right? In the middle of what doctors call a STEMI, a really serious, life-threatening heart attack, there's only one goal: get that blood flowing again, and fast. So what if you had something that could do just that, almost instantly?
Well, this is where Tenecteplase comes in. It's the hero of our story today, a medication designed for exactly this kind of high-stakes, time-critical situation. So what is this stuff? Tenecteplase, or TNKase for short, is what's known as a fibrinolytic drug. The name kind of gives it away. Fibrin is the protein mesh that makes a clot sticky, and lytic means to break something down. It's a tissue plasminogen activator, which is a fancy way of saying it's a super smart enzyme, almost like a tiny biological missile designed to hunt down and obliterate dangerous blood clots.
And here's what makes it such a game changer. You see, older clotbusters often needed a long, slow IV drip. But Tenecteplase has what's called a longer half-life, meaning it stays active in your body for a longer period. This is huge because it means it can be given in a single fast IV push. We're talking 5 to 10 seconds. When every single second counts, that speed is absolutely everything.
Okay, so how does it actually do it? How does it bust that clot? Let's get into the science of what's happening on a molecular level. And don't worry, you don't need a biology degree for this, I promise.
The best way to think about it is like this. Tenecteplase unleashes a pair of molecular scissors. First, it zeroes in on the fibrin, that sticky web holding the clot together. Once it's locked on, it finds a substance called plasminogen and flips a switch, turning it into its active form, plasmin. Now, plasmin is the body's own natural clot dissolver. It's those molecular scissors we were talking about. And it immediately goes to work, snipping away at that fibrin net until, boom, the clot dissolves and that crucial blood flow is restored.
And get this, the speed is incredible. The actual breakdown of the clot usually kicks in within about 20 to 24 minutes, and the drug's effects stick around for a good 90 to 130 minutes, giving it plenty of time to work its magic, all from that one super-fast injection.
Okay, so this drug sounds amazing, right? But that brings us to a really important question. Who can actually get it? Because a drug this powerful can't just be given to anyone. Getting the patient selection and the dosage just right is absolutely critical.
Its main preferred use is for treating a major heart attack. But you'll also see it used off-label in other emergencies, like for massive clots in the lungs or for strokes caused by clots in the brain. And when you hear off-label, all that really means is that doctors are using it for something other than its official FDA approval, but it's based on solid medical evidence that it works.
But honestly, what's even more important is knowing when not to use it. These are the contraindications, the deal breakers. Since this drug literally dissolves clots, giving it to someone who is already bleeding or has a bleeding disorder or just had major surgery could be a disaster. The same goes for anyone with a history of bleeding in the brain, super high blood pressure that isn't under control, or someone who had a seizure when their stroke started. These are all absolute red flags. So, once a patient gets the green light, the dosage has to be super precise. For a heart attack, the dose is all based on the patient's weight. As you can see, usually somewhere between 30 and 50 milligrams. But for a stroke, the math is a little different. It's 0.25 milligrams for every kilogram of body weight, with a max dose of 25 milligrams. And no matter what, it's always given as that one single fast IV push. And finally, let's talk about the other side of the coin, the risks and the special handling this drug demands. Because with this kind of power comes a whole lot of responsibility.
So it's probably no surprise that the number one risk is bleeding. It can happen anywhere, but it's most dangerous if it's in the brain. Other things to watch for are a sudden drop in blood pressure,
allergic reactions, and something called reperfusion dysrhythmias. This is basically when the heart's rhythm gets a little wonky as blood suddenly rushes back into that starved muscle.
To keep things safe, the medical team has to follow some very strict rules. The vial has to be gently rolled to mix, never shaken, because that would literally destroy the delicate enzyme. It can only be mixed with sterile water, and it needs its own dedicated IV line. And because the patient's ability to form clots is way down, simple things like regular injections into a muscle are a no-go, and even moving the patient has to be done super carefully to avoid any bruising. When you step back and think about it, Tenecteplase is pretty amazing. It's a single, fast injection engineered to dissolve a life-threatening clot and literally stop a heart attack in its tracks. It's just a stunning example of medical progress. And that just leaves you wondering, doesn't it? If this is what we can do today, what kind of incredible breakthroughs are waiting for us just around the corner?